Assistant Attorney General for the National Fraud Enforcement Division at the Department of Justice. I am joined today by a lineup of committed public servants who are devoted to protecting the financial security of America. Today, we are announcing criminal charges against 15 defendants in Minnesota for fraud schemes that targeted over $90 million in taxpayer dollars. Let me be clear up front about something. This is not the end of our work in Minnesota. This is not the end of the beginning of our work in Minnesota. This is the beginning of our work in Minnesota. The fraud here in Minnesota is shocking. Our cases today involve 7 different state-managed Medicaid programs that have been systematically pilfered by fraudsters who treated Minnesota-run programs as their personal piggy bank. One of the programs has been completely shut down because there's no money left. It's all gone. That was Minnesota's state-run Housing Stabilization Services program, designed to help the homeless find and maintain housing. It was estimated in 2020 that it would cost only about $2.5 million a year to fund this program, but it ended up costing almost 50 times that much, over $104 million by 2024 due to fraud. And because of all the fraud, Minnesota had to shut the program down in 2025, and now these services no longer exist for these vulnerable homeless populations. The same trends exist for other Minnesota-run taxpayer-funded programs. An autism program that cost the taxpayer $600,000 just 6 years ago skyrocketed to over $400 million. And to be sure, that number is not driven by supply and demand. It is not driven by health care or charity. It is fraud. To tackle this crisis, and it is a crisis in Minnesota, earlier this year, the Department of Justice surged 11 strike force prosecutors from across the country to be here on the ground fighting the rampant fraud targeting our taxpayer-funded programs. And large numbers of agents from our partners at the FBI, HHS-OIG, HSI, IRS-CI, and others joined our prosecutors to rapidly unmask fraudulent actors in Minnesota. These agents and prosecutors have been working around the clock to root out the criminals stealing taxpayer dollars, and I am proud of all they accomplished in such a short time. Their hard work made today possible. Make no mistake, today's charges are unprecedented. They include the highest loss amount ever charged in a Medicaid case in Minnesota and the largest autism fraud scheme ever charged by the Department of Justice. The common theme throughout these cases is fraudsters exploiting vulnerable programs and vulnerable people to enrich themselves, no matter the consequences to the programs or to the people. For example, one defendant is charged with defrauding the Integrated Community Supports Medicaid program. This program is designed to help individuals with disabilities live independently. One patient was supposed to be receiving 24-hour care through this program, but he was actually being serviced by a fraudster and received no services. This patient was later found dead. Meanwhile, the architect of this fraud scheme was billing Medicaid as if he was providing care to this patient. The defendant even submitted a claim of over $400 for services he never provided the day before this man died. In another example, 2 defendants have been charged for defrauding a program designed to offer medical services to those with autism spectrum disorder. As alleged, the defendants paid kickbacks to parents who brought their children to autism centers, diagnosed children with autism regardless of medical necessity, and billed for autism services that were never actually provided. In one final example, 2 defendants have been charged in an over $22 million fraud scheme involving the Individualized Home Supports Program. This program was meant to support disabled individuals who wanted to live in their own homes. Instead, these disabled individuals were used like lottery tickets by these defendants to generate millions of dollars, which these defendants used to expand their real estate holdings, purchase luxury vehicles, and splurge on expensive jewelry. We will not, full stop, tolerate this greed and deceit. We will not let fraudsters bankrupt Medicare and Medicaid the same way that they bankrupted the Housing Stabilization Services Program. As mentioned, this is just the beginning. With the support of President Trump, Vice President Vance, Acting Attorney General Blanche, Chairman Ferguson and the White House Anti-Fraud Task Force, Secretary Kennedy, Dr. Oz and his team, and the entire federal fraud-fighting apparatus, the Department of Justice will continue expanding our reach across the country to pursue all fraud, no matter how large, no matter how small, no matter how hard. Since April 1st, DOJ's Fraud Division has announced over 450 fraud enforcement actions nationwide, representing billions of taxpayer dollars. And this week already, we're delivering results coast to coast with a trial conviction in Brooklyn involving a $40 million drug distribution and fraud scheme, and a trial conviction in Los Angeles involving a $40 million Botox injection fraud scheme. To expand our reach, we are announcing today the expansion of the healthcare fraud Midwest Strike Force to Minnesota and the hiring of 15 additional prosecutors dedicated to combating Medicaid fraud nationwide. These additional resources will ensure that the DOJ's Fraud Division will be better equipped to stop fraud and hold criminals accountable. My message to the Minnesota community and to all of America is this: if you see something that seems too good to be true, tell us. In some areas, such as in the daycare prosecutions we announced today, a culture of fraud has taken root, where child care centers even offer kickbacks to parents to enroll their children. If something sounds good to be true, it is. Do the right thing, speak out, help us win the fight against fraud. And now my message to the fraudsters is this: eat, drink, and be merry today, because your days of frolicking and freedom are numbered. We are doing everything we can to find you. And when we do, we will prosecute you. And we will claw back every dollar you have stolen from the American people. We will not rest until every fraudster knows that the cost of stealing from the American people is far higher than any scheme is worth. Thank you all for being here. I'll now turn the podium over to Secretary Kennedy. You have stolen from the American people. We will not rest until every fraudster knows that the cost of stealing from the American people is far higher than any scheme is worth. Thank you all for being here. I'll now turn the podium over to Secretary Kennedy.
Thank you, Colin. Hey, everybody. I want to start. I thought I was going to have a slide here. I want to call your attention to this, which is in your... Okay, here it is. Which is in your packet. This was the cost of the Early Intervention and Development Program in 2020. It was $38.1 million. This is what we expected to be paying every year. Instead, this year it hit $442 million. And that is, I'm showing you that because that's the magnitude of the fraud and the damage that we're talking about today. And I want to thank Todd Blanche, who couldn't be here today, Colin McDonald, and everyone at the Department of Justice for leading this effort. I want to thank also the FBI, who you're going to hear from in a little while, the HHS Office of Inspector General, CMS, and especially Dr. Oz, the White House Anti-Fraud Task Force, and Vice President Vance, and the investigators and law enforcement personnel whose relentless work made today's action possible. Today's arrests represent the largest autism fraud bust in American history. This was not a paperwork error. It was not a technical violation. This was organized theft that exploited the most vulnerable children in America, deceived families, stole taxpayer dollars meant to help children with autism access legitimate care and support. Investigators uncovered brazen schemes that billed taxpayers for non-existent services, fraudulent diagnoses, and fake care, while criminals enrich themselves at public expense. Every fraudulent autism diagnosis steals time, care, and resources from the children for whom this program was denied and who desperately need this care. Families with autistic children already face enormous challenges navigating therapies, specialists, and support systems. Fraud makes those barriers even steeper. America is facing a real autism crisis. Today, approximately 1 in every 31 children is diagnosed with autism spectrum disorder. Medicaid finances a significant share of autism-related services nationwide, and spending has risen dramatically over the last decade, and a lot of that spending is because of fraud. When criminals exploit these programs, taxpayers lose billions, and vulnerable children lose their access to care. Healthcare fraud now costs the United States tens of billions of dollars every year. Some estimates place the broader cost of healthcare fraud and improper payments at $100 billion annually. That fraud drives up healthcare costs for all Americans. It weakens public trust. It drains taxpayer resources and threatens the long-term stability of both Medicaid and Medicare. If we fail to confront the fraud aggressively, these programs will not survive for future generations in the form Americans rely upon them today. Under the leadership of President Trump and Vice President Vance, this administration is carrying out the most aggressive anti-fraud effort in American history. And I want to be clear, this is an extraordinary bust today, because these kind of operations usually take many years, sometimes a decade. This was executed with a precision and speed that is unprecedented in the history of law enforcement. And it's unprecedented now, but under Vice President Vance's leadership and President Trump's direction, we are going to normalize this speed. We're restoring accountability, strengthening oversight, prosecuting criminal networks, and protecting the integrity of our public health systems. We will not allow criminals to treat children as billing opportunities while American taxpayers foot the bill. This administration will continue rooting out fraud because every stolen dollar is a dollar taken from a child, a parent, a senior of a family who desperately needs help. We're going to protect these programs and protect vulnerable children and restore integrity to the American healthcare system. And now I want to introduce the United States Attorney Rosen.